Hi, welcome. My name is Ed Marx. I serve as the Chief Digital Officer at Tech Mahindra Health, Life and Sciences. And I'm really excited about today and the webinar that we have for you, the secret to effective CMI-CIO collaboration and relationships. This is such a critical topic for many, many reasons. And I can't think of a dynamic duo better than Ray and Eric to join us today and share their insights that we can all use when we think about our relationships. And even if you're not a CMIO or CIO, certainly the principles that they'll talk about, the best practices, apply to you wherever you are in terms of that relationship that you have with the clinical side with technology. And the two married together well transforms healthcare. So thank you, Ray and Eric, for joining us. This is live, and we love live for two reasons. One is anything can happen. And I'm playing bossa nova music right now for my dogs in a different room to keep them calm. They like the bossa nova sound. And the second thing is it's interactive. So if you have any questions for Ray or Eric, please enter them on the side box. I will pick them up. So anywhere along the way. So we're going to jump right in. So I'll let both Ray and Eric introduce themselves, and I'll start with Eric.
Hi, so I'm Eric Lee, Medical Director of Clinical Informatics here at AltaMed Health Services, and I've been with AltaMed for a little over 2 years now. I'm board certified in internal medicine and clinical informatics, and apart from that, I think I probably have one of the more unconventional backgrounds as an informaticist, having previously worked in correctional healthcare and then now working for a federally qualified health center. A little bit about AltaMed Health Services. It's one of the nation's largest federally qualified health centers, and we provide primary care, women's health, PACE, which is Program for All-Inclusive Care of the Elderly, dental, behavioral health, and health education and wellness programs for over 300,000 patients in Los Angeles and Orange counties. A couple things that make AltaMed unique. So number one, 2/3 of our patients live at or below the poverty level. Number two, 80% of our employees actually live in the zip codes and the communities that we serve. And number three, AltaMed espouses a whole person approach. As an example of that is the My Vote, My Health, or Mi Voto, Mi Salud campaign that has been taking place over the last 2 years. And the approach is that improving health starts with empowering those that we serve to vote and affect change. So our civic engagement team, for example, had registered over 500,000 Latinos in underserved areas who otherwise would not have voted.
Yeah, that's amazing. A very all-encompassing organization. I don't know that there's any or too many like AltaMed. Ray, can you introduce yourself and at the end talk about how long you and Eric have served together?
Absolutely. So Ed and HCI Group, first, thank you for inviting us to this podcast. We're actually very honored that you view our partnership as being one of the strong ones that perhaps other people can learn from. So I think it'll be a fun one. So my name is Ray Lowe, and I'm the Senior Vice President and Chief Information Officer here at AltaMed. I've been here almost 3 years, so January will have my 3-year mark. And prior to being here at AltaMed, I had worked at Dignity Health in senior leadership roles, Providence Health Services. I oversaw 5 hospitals. Kaiser Permanente oversaw 3 hospitals. And I think one of the unique things is coming from big systems and coming into a mid-sized healthcare, there's a lot of good practices and a lot of good partnerships and relationships that you learn from that you're able to employ here. So in our bios, it talks about Epic and our journeys around there. I think part of the magic is that Dr. Lee did that in the prison system. I did that within Dignity Health and their environment, both very challenging environments with very good quality outcomes, and we're able to take those skills and apply them here, basically. Okay, and so Dr. Lee and I guess the fun part of that is it's always great when you're the CIO and you get to be on the panel for selecting your physician partner, right? And so that's a gift. It really is a gift, and you kind of have the ability to really assess, can we work together? Can we not work together? Are we going to butt heads together, or whatever? Fortunately, Eric was one of our applicants. He absolutely rose to the top, as cream would. And he joined us in August of 2018. And it was really just 2 weeks before we went off to our Epic UGM. So he was really forced, right, to hit the ground running and pack his bags. And then off we go to Epic Land for UGM. And it's overwhelming, as it was for both of us. But we had a lot of good learnings. And I think since we established that pace so early on, that Dr. Lee is used to wearing his roller skates and going with us where we need to.
Yeah, that's awesome. So you guys have a good 2 years of tenure together. So we're going to start with sort of what I would consider like an easy question, and we're going to get a little bit harder. So share with our audience one key of a great CMIO-CIO relationship. So what is one key? Eric, we'll start with you.
So, I think if I had to select one key, it'd be constant communication. It's probably overstated, or people just think I'm stating, a duh. No, that's a no-brainer, right? It's just an overused, overexpressed kind of phrase. But I really believe to develop a great dyad partnership, it doesn't work if you have a one-on-one scheduled once or twice a week. It just really doesn't. I think it's Ray and I, we still schedule them so that we can continue to ideate and brainstorm and whiteboard further. But it's on top of what we're doing. Like Ray and I are constantly communicating. We're communicating multiple times a day, just to keep each other updated on what's going on in our respective worlds.
Yeah. That's great. And Ray, what about you? What's the one thing?
Yeah, I would like to use the word integrity around there. The basis of integrity is integer, which means, one and moving in the right direction. And so I think, Dr. Lee and I have such good integrity with each other, and that we view things ultimately to how do we reach that ultimate goal, and when we start maybe going a little bit sideways, we quickly realize it, or one of us were so in tune to each other that we can kind of check each other, right? So if somebody's having a little bit of a stressful day, which will happen, your counterpart kind of reads it and gets it, and it may not be as high of a priority for me as it is for Dr. Lee, and we're able to kind of just talk through and kind of maintain that integrity of what we're looking to deliver in terms of our healthcare system and serving our patients and our providers.
No, those are really two good points. I'm taking notes here as we go along, because I have a CMIO as well. I have a counterpart in my role, and I think some of the things you hit on are really key. One thing I do know about both of you is that your offices are in close proximity. Is that accurate? And what do you think about, what would you share with others who might not be in that situation? I mean, is that something you would push for?
Well, it's kind of funny because originally Dr. Lee was on the 3rd floor and I was on the 1st floor. I mean, IT and healthcare, you're usually located on the 1st floor in the basement by the morgue, so on and so forth. For my hospital CIO friends, I've been in those spots around there. But actually Dr. Lee does sit next door to me, which makes it, very easy for us to have, quick check-ins. But also, with the advent of COVID and the social distancing and the remote works, Dr. Lee, we're not always together every day, not by any means, right? And it's really how do we use our collaboration tools to stay close, because the video is important to share the information and collaborate and continue to talk. But there's also so much strong value in that interpersonal, personal contact to keep that relationship strong. I don't know, Dr. Lee may have liked being on the 3rd floor, so he doesn't hear me talking. He may have a different point of view, but I'll defer to you, Dr. Lee.
No, it makes it a lot easier, right? I think, whether you're apart, you start apart, and we now share a wall between our offices, it just makes it a little bit easier. But I think you still have to make that effort, right? And it shouldn't feel like effort, it should be effortless. And if it's not there, it's what you work on to make sure you're constantly communicating, because you can pick up your phone and you can text, or you can use a collaboration tool like Teams, for example, right? And so there's all these different modalities. That's what technology has afforded us, and it's just keep the lines of communication open.
Yeah, those are great. So I'm just going to keep going with this particular flow of thought here. So you talked about, what is the, one main thing in the relationship that makes it work. We talked a little bit about physical proximity, or if not physical, definitely the virtual proximity. So let's talk about a time in 2 years, certainly you've had material conflict. certainly there's been a time where you disagreed on something. So Ray, we'll start with you, and Eric, just to tee you up, maybe if you come up with a different example from Ray. So Ray, can you talk about a time where you had a material conflict, and how did you resolve it?
Yeah, so I mean, Ed, I think you've been witness to the clinical digital transformation we've really accomplished here at AltaMed in the last 2.5 years, which has been at a breathtaking speed. And as we've looked to how do we deliver a mobile first strategy, and with digitally enablement to low income and underserved populations, and Dr. Lee and I, we've gone back and forth. So the example that kind of jumps out to me is remote patient monitoring. There are many providers in that space that are vying for your business. And, Dr. Lee was so enamored with one. He absolutely loved it, and I wasn't quite sold that this was the right solution, as we wanted to move ahead around there. I don't know that we weren't getting scrappy about it by any means, but, kind of honestly, our approach is we have a 6-story parking structure. We take a lot of walks in that parking structure, walking all the way up to the top, all the way back to the bottom, and we kind of just say, what's kind of going on? What are we seeing? What's the outcome that we need to look at? So I think if we have a material conflict, we really kind of just take a pause. We talk about it. Walking and talking is fantastic, right? And that's kind of how we've worked through it. Dr. Lee may have a different perspective, but he may have not liked some of the technology decisions that I've put forward.
Yeah, Eric, your thoughts?
So I think sometimes it can be different perspectives about how we approach problems, and it's really an understanding that we're all human beings and we're all built differently. And so I like to be challenged, actually. So I think it may be a staffing issue or just a staffing question. And in this era of the pandemic, where budgets have considerably and purse strings have considerably tightened, you have philosophical differences at times at how you're going to approach a staffing need. And so I think but again, it's our daily walks almost in our parking garage, for example. We serially discuss and then we evolutionize what our approach is going to be. And we've done this over, for example, with this staffing issue. It's been this evolutionized approach that we've arrived at over the period of months, really, of how to best make the pieces work. So it's almost like we're walking and talking. We're working this jigsaw puzzle and moving the pieces around constantly, but it's I think that's kind of what we end up how we end up handling it.
Yeah. If I could add on to what Dr. Lee says, I really think a key, when you're dealing with these complex systems, is ability to be a puzzle master. And it's so intricate to how you have to build the technology, build the application, build the clinical workflow, build the adoption around there. And when you have two folks with different viewpoints, the sum of the outcome is better than the parts, because I would look at it to a degree, and then Dr. Lee will take this operationally and we'll think, what do we need to do? How do we need to change it, right? And then we ideate in terms of, well, what's the best pilot? What's the outcome? And then given our different relationships in the organization, we're actually able to drive other C-level suites or provide strong recommendations on an approach, right? Whereas I think individually, we may not have been successful having those conversations.
Yeah, those are good insights. I just want to remind everyone, we're halfway in. This goes by fast. If you have questions, comments, please enter them in. We're happy to take a look at them and weave them into the conversation. All right, I'm going to pull a little switch on Ray and Eric, because as I'm listening, if you didn't have the context of CMIO-CIO relationship, we could be talking about a marriage relationship, right? Think about it. You're talking about the unity, the integrity. You were talking about the communication. You were talking about talking things out. You're talking about challenging each other and getting to that next level. So as my mind thinks about, okay, it's a tight relationship, right? So in a healthy relationship, you would be proactive to do something to strengthen the relationship. So it's a strong relationship. You're doing the things that you talked about, the walks, challenging one another. What would you say is something that you might be doing that actually helps strengthen the relationship? So it's like almost like a proactive thing, much like you might, help. Just forgive me a little bit with my analogy of marriage, but like in marriage, they would say, keep dating your spouse, right? You don't stop dating once you get married. So what can a CMIO, CIO do to keep strengthening? So you guys got a good relationship. What can you do to keep strengthening it?
Well, let me start with that one. I think there's the concept of control, and how do you manage that control, or do you need to control it? Do you need to micromanage it? I think we have a very good mutual respect of our areas, and we don't micromanage each other. We don't, right? And so Dr. Lee will go off and work with our executive physician leadership team and present solutions, or he'll work with some of our ancillary services in terms of how we're doing secure messaging. Honestly, I'm not even aware that these conversations are going on, but they're very important messages. On the corollary side of it, as I look at the technology stack that was required to deliver a mobile first strategy, again, to your cell phone, through your portal, through the televideo around there, Dr. Lee is not looking at what I'm doing with Cisco, AT&T, what I'm doing in the data center, how I'm building out the bandwidth circuits and the 5G IoT things, right? But we trust each other around there, and then it's kind of like one of us probably says, "Hey, I was doing that," and I, like yesterday, I was like scratching my head. I didn't even know where he was going in terms of our HIPAA compliant secure messaging and how far he had gone. That's really my opinion. We don't micromanage each other. We trust you're doing the right thing, and then it works well. But I'll defer to Dr. Lee again if he has a kind of a different point of view.
Yeah, I mean, I think it also, we have a shared vision already. So we have an approach of, a mobile first strategy for our patients, a mobile first strategy for our providers, and how are we going to enable that? And so there's core components to each of them, and then it's almost like we naturally divvy up the work and say, okay, I'm going to go off and work on, we're enabling mobile for our providers and with secure texting or secure messaging, and I get into the weeds of that, of how I'm going to enable that, right? And meanwhile, if we have some other core strategies, whether it's CRM or ERP, for example, Ray, will go off and handle those issues. And then it gets back to, we update each other on what's transpired, right? And so at a high level, we know what's going on in all these different facets and areas of the organization. And again, it goes back to constant communication and integrity, right? I trust Ray implicitly, right, and explicitly, and I trust he's not going off and sandbagging me or doing things behind my back and micromanaging me, and and it's the same thing that Ray has that same trust and integrity in me, and I have his back to the utmost degree, and that's how we complement each other.
Okay, the only time I micromanaged Dr. Lee was on the HIMSS floor for many years ago, and he's a deep thinker and wants to learn everything about it. And I'm the kind of guy going, I've got 14 people to hit in 3 hours, put your roller skates on, and you're gonna run with me. So that may have been one of the few times that I actually micromanaged Dr. Lee to keep him moving because he wanted more and more information.
Yeah, this is good stuff. We're gonna pivot to questions. So we have many questions that have come in. We're gonna pivot to them. That's the beauty of being live. But I just wanna summarize in 30 seconds. The keys to a successful collaborative relationship that you all have expounded on is communication, trust, integrity, oneness, time together, the walking, physical proximity, although you can transcend that, but the physical proximity surely does help. So those are excellent points. And if I were anyone listening, a CIO, CMIO, or again, any sort of relationship where you're working with a clinical or IT counterpart, is build those things in, and it comes through. You got to build that trust, comes through relationship. Okay, let's jump to some of the questions. Eric had made mention of budget management. How do the two of you collaborate and decide on the metrics used to evaluate investment options? Because obviously you have a $100 million worth of requests. You only have $10 million to spend. How did the two of you prioritize?
Well, one, there needs to be good business justification, right? I don't believe that we do technology for technology's sake. I think the other part of it, as we look at the clinical digital transformation, is how do these investments align with where we're going, because we're doing really disruptive technology and innovation. On the ROI, that's really a kind of a straight line financial valuation. But the interesting part is, how do you turn the soft cost optimizations, which is really process and efficiencies, in order to do that and incorporate that in your TCO. So generally, of course, I will run the financial reviews and run the cost modeling behind that. Dr. Lee absolutely provides into the workflow, the optimizations, how we can improve things. And our lens isn't towards job elimination. Our lens is towards how do we do things better so that the staff can be more productive, or staff can be redeployed to do other type of activities to serve our patients and providers.
Okay.
Yeah, from my perspective, don't lose sight of the quadruple aim. And if you stay grounded in that, things will declare themselves. And there's a book called The Digital Doctor that Dr. Bob Wachter had written almost 8-9 years ago. One of my favorite quotes in that is, all the technology in the world is not going to help you if it's not intuitive and if the end user can't use it. And so, again, all these pretty toys that are out there, if the clinician has to then log into a different portal and have to remember another username and password, even if you've enabled SSO, it's not going to get utilized. And so you have to keep that kind of workflow and process in mind, and efficiency of workflow, ease of use, right? And I think those kinds of things are, you hope there's a financial hard ROI on that return, right, of making that investment. But I think if you get increased usage and happiness or satisfaction with the results you're seeking, I think that in the end the end will justify the means as well.
Great. We have one question in there. First, it's a comment about how great Ray and Eric are. We know that already. That's why you're with us today. What is one piece of advice, and I'm going to switch it a little bit to a question that we talked about right before we came on camera. What is one thing you would look for? So we'll start with Eric. Eric, let's just say that Ray went off and became the CIO of the United States of America. And you were hiring, a new CIO is coming in. What is one or two traits that you would look for? And then Ray, we're going to flip it. Eric has become the Surgeon General, and you have to replace him. What are one or two traits? So Eric, we'll start with you. What's one or two traits that you would look for in an incoming CIO?
It's hard to learn things in an interview sometimes, right? And I think I'm a big fan of like role playing or scenario based questions. But I think it's more of lots of listening, and it's learning about what worked and what didn't work, more importantly, and the lessons learned from the prior organization or organizations this CIO candidate or the incoming CIO has worked at, and and how they can enable AltaMed's quadruple aim. Because I think again, it's I want to know what didn't work, what can we do better, how can I complement and complement this new CIO and form a new dynamic duo, right? I think that's always a goal of what you want to do.
Yeah. Okay, good. Ray, same question, sort of reverse.
I think there's two things I look at. On the technical skills aspect, the clinical understanding, the EMRs, mobile patient engagement, those are very tactical skills. They're just really table stakes that a new CMI needs to be well versed in, and really what their point of view is. I think more importantly on the partnership, it's about emotional intelligence, and how reflective, how do they think, how will they align, how will that emotional intelligence play out in hard times, because we've had to make some very hard decisions that multi-million-dollar decisions and recommendations around there, and how are we going to do it, and are we going to be able to have, you know, the proper open conversation and call it when we're done enough. So the emotional intelligence, you know, and really the clinical technical competency of the areas that we serve.
Yeah, both excellent things for aspiring CMIOs, CIOs to know. So we're going to hit another question. We probably have time for one question after this one. So if the audience has any more things you want to hear from Ray or Eric, let me know. Otherwise you might be stuck with another marriage analogy. I don't know. So I know that AltaMed, you all are very innovative in the approach to medicine, and as well as with the technology. So it goes back to a similar question we had earlier in the budget, but how do the two of you work together to evaluate like R&D opportunities or innovation opportunities? What are the things that you look for, and how do you work together on that?
Dr. Lee, I'll let you go first.
I'm a very you know, detail oriented. So I think you know, I think the first instinct is that, you know, you go to the website, you do some exploration, you take a look at what the bells and whistles are, and then you start thinking about the process and the workflow. But innovation in itself, again, it's you know, I think there's always a few core questions that Ray and I have learned to always ask. Is, you know, number one, do you have you know, in our case, we're an Epic shop, so it's, you know, do you have App Orchard certification, right? And if not, you know, what other orgs have you done this with? So there's almost a you know, you have to prove it initially or right away to kind of get your foot in the door with us, and to be able to get serious consideration and a serious look. I also think, you know, obviously there's cost, there's other considerations, there's success, what have you done previously to move the needle, and again, you know, further that quadruple aim, how is this going to improve the practicing lives of our clinicians? So those are some of the things I take into consideration. Ray, I'll turn it to you.
Yeah, I mean, that's a great question, Ed. You know, EMR has been around for a long time, and there has been really phenomenal work that has been done by Cleveland Clinic, Stanford, Kaiser. So a lot of the core kind of roadmap of what you need to do is defined. There are things that you need to do. And so we kind of baseline there, right? Just understanding our path, because again, 3 years ago, we had no wireless in any of our facilities, and we are on an older EMR system, so we did a full transformation where we are today. The other thing I look at is it's so important to have a strong network out there, through the Chime network or other areas, that you're able to, for me personally, to reach out and you know, to talk to Patrick at City of Hope, or Neil or Zoffer up in Seattle, you know, or Aaron down at UT. And really, you know, leverage what they're doing, you know, and bringing that information to us. And then, you know, we kind of have some cross collaboration. So it really almost becomes a national view of how you can really kind of approach a problem. And that partnership and that ability to kind of ideate with your network of folks is so important. They advance you so quickly.
Okay, final question, but it has to be answered in less than 60 seconds. You mentioned the Cleveland Clinic, so the Cleveland Clinic has a question for you. How do you both look at incorporating patient first sort of thinking? So we talked a lot about technology and budgeting, you know, and ROI and things like that, but how do you incorporate the patient point of view and everything? And I'm assuming you do. How do you do that? 60 seconds or less.
I think I'm gonna take an angle that not generally approached by most organizations, is that, you know, we're actually fortunate to have a cultural linguistics department, and so, you know, one out of every 2 patients has a preferred language that's not English in our organization and in the patients that we serve. So it's really this cultural competency, and I think our patient portal, for example, I think we were able to do an SBAR assessment and really dive in and improve the product from a Spanish translation perspective. And I think that's one example of how we've helped in taking the patient experience into consideration.
That's good. Excellent. Right?
I think what I would add on that again is you have to have a point of view of what is the patient digital literacy and their the clinical understanding. And so the messages that we deliver in order for us to be successful and to really change the quality of their lives and make it easier for them always has to be forefront, because we can put out a lot of really interesting, innovative things, but if our patient population doesn't have the ability to understand or utilize it, we failed. So we really need to look at how do we have that adoption, how do we have that validation. So kind of on a quick point is, we built out a simulation lab here so we can actually see what is the experience from patient all the way, to the provider and all stops in between, and we can adjust the workflow or make a change in Epic or something along those lines so that it really does reflect the message and the engagement we're looking for.
Yeah, that is awesome. Both linguistics and Ray, what you just reminded me, I actually wrote about that in a chapter in a medical textbook coming out. How your innovation lab or your lab where you test things out, patient experience, that is a best practice. You AltaMed, all about best practice, the way you take care of your patients. It's clear, I think to everyone attending today or listening at a later time that you are the dynamic duo, very tight just in 2 years. The relationship that you built, the things that you shared, again, I made the kind of a fun analogy to marriage, but to any good relationship to accomplish digital transformation, especially, you've got to have those things kicking. You guys are awesome. Thank you so much for being my guest today.
So, thank you so much for having us, Ed.
Yeah.
We're really honored.
You guys are awesome. I wish we had more time. Upcoming, so we're down to 30 seconds. I just want to let everyone know about upcoming webinars for Chief Digital Officers. We have the first conclave of Chief Digital Officers across health and life sciences. So the first time ever that we know of that we'll have CDOs from payers, providers, biotech, pharma, medical devices, because there's no reason why we shouldn't be together. We always create ourselves these stovepipes that are unnecessary. And then finally, we end the year with my CEO of Tech Mahindra, CP Gurnani. If you've ever heard him speak, he's just an amazing speaker, and he's going to talk about digital transformation around the globe. Thank you, everyone, for being with us. Take care. Bye now.